Anybody do any weightlifting in here? Sitting. Most of your activities are performed in a sitting position. When you sit down, you completely unload that region of the hip. You know, you got those bones in your butt, your ischial tuberosities, that's part of your pelvic girdle. So all the weight is now on the pelvic girdle, and none of it is on this region of the hip, which is where you're trying to get some benefit. So it's important when you're doing weightlifting to try to do some exercises in the standing posture, or to at least do exercises that are going to engage hip musculature in different ways than just extending your leg back and forth. So you have to do some hip abduction and adduction. Lunges are great activities for this, but something that engages the hip musculature in unique ways. So this is the summary to this point. We do have good evidence, moderate but good, that physical activity can both prevent fractures and help preserve bone mineral density. Let's talk a little bit, though, about some of the evidence that we have that might give us better insight into the types of activities that are likely to be effective. Perhaps the best evidence that we have that physical activity is absolutely essential for maintaining good bone health is what happens during bed rest, when we go from being in an upright posture to a supine posture for long periods of time. This was a study conducted over 4 months in healthy young men. And let me go to the next slide because I put these numbers now into tabular form. After 17 weeks of bed rest, these young men had 3 to 4% decreases in bone density at these clinically important sites. Normally, young men would not be losing any bone over this time interval. And even if we were studying postmenopausal women who have accelerated rates of bone loss, those rates in postmenopausal women would only be about 1 to 2% per year. And these are 3 to 4% over 4 months. So becoming very physically inactive has rapid and profound adverse effects on the skeleton. That becomes very important in old age when you have injuries that cause you to be immobilized for long periods, or you have illnesses that cause you to become less active. So that's scary enough. But what's even more scary is that 6 months later, after they had returned to their normal activities, they had recovered very little of the mineral that they had lost. Now, it may take longer to gain bone back than it takes to lose it. And actually, you have some very good research going on at this institution about that. And that's what this group of investigators suggested when they were discussing the results of their study. But I have another hypothesis. So this is the hypothesis according to Kohrt. We know that bone isn't just an inert tissue. I mean, we think of it just being there and not doing anything metabolically. But actually, you're always turning over bone. You're always chewing up some old bone and replacing it with new bone. So it is metabolically active. And the act of chewing up old bone is called resorption, and the act of building new bone is called formation. So most of us are in a state of equilibrium where the rate of formation equals the rate of resorption, and we're not gaining or losing bone. And our normal activities help us maintain that. If we engage in very high intensity impact, we can influence the rate of formation, make that go up. So now formation exceeds resorption and we have an increase in bone mass. Or conversely, we go to bed for 17 weeks and the rate of resorption exceeds the rate of formation and now we lose bone. So in that study, after 17 weeks of bed rest, what did they do? They went back to their normal activities. Would you expect them to gain bone then? Or would you just expect them not to lose any more? They're just going back into equilibrium. So my hypothesis would suggest that if we want to help them recover that mineral faster, that we need to bump them up into this window where they're doing more vigorous activity than they were previously. So is there any evidence to support the hypothesis of Kohrt? I don't know of any in humans, but there's a very interesting study in animals, in rodents, where they immobilized them for 3 weeks. And this is the change in trabecular bone volume, the spongy type of bone. And you can see these dramatic reductions, almost a 25% loss over just 3 weeks. And then they had one group of animals that they just put them back in their cages and they went back to their normal activities. And what do you know? All we see is that we stopped the rate of loss. Didn't gain any back, didn't lose any more. But then they had 2 other groups of animals. They called these remobilization, where they actually engaged some treadmill running. And one group did that at a low intensity, and they gained back about half the bone that they had lost. And the other group was actually high intensity, and they gained back almost all of the bone that they had lost. So I think this has potentially very important implications for rehabilitation. I don't know if you've got a physical therapy program here, but one of my complaints about physical therapy is that they just try to get you back to where you were. They don't try to get you beyond that. And I think, again, in old age, that becomes very important. Just getting you back to a functional status that you might have been at before maybe shouldn't be the goal. We should try to be a little bit more aggressive in restoring physiologic function after some period of immobilization or disuse. So what types of activities are likely to be most effective in how they influence bone? These are things that we've known from animal studies for almost 30 years now. High intensity, high magnitudes of strain seem to be more effective, and when you have high intensity forces, it seems like only a few are effective at maximizing the response of bone. They have to be dynamic, not static. So doing isometric type of exercise wouldn't be as good as doing isokinetic, where you're moving, not just doing a muscle contraction and holding it there. You actually want your arm to be moving if you're trying to influence bone. We know that high strain rates are important. That's the rate at which the bone has to respond. So that means doing things quickly is better than doing things slowly. And for bone to respond, it has to be seeing a diverse or unique type of force acting on it. So if you've been walking 3 miles a day, every day, for the last 15 years, going out and doing 3 miles a day tomorrow is not going to be anything new to your skeleton. So it's really not going to have to adapt to that. If you want to get it to change, you have to stimulate it in a way that it hasn't seen previously. And finally, the response is going to be specific, not general. So if you want to improve your hip bone density, you're not going to do arm exercises. I want to show you just a couple of the studies from these. These are landmark studies that were conducted almost 30 years ago now, because they are so eloquent in how they made the point of these factors being important. These are studies where they controlled the amount of stress that they applied to bone. So think of this as the intensity of the loading force applied to bone, and this is the change in bone mass that occurred. So the higher the intensity of the force, the greater the bone response to that force. This is my all-time favorite slide because there's so much information packed in here. There's 5 important points that I want to walk you through. This is an animal model. It was done in turkeys, where they put pins in either end of one of the forearm bones, and then they could put it in a device where it was either immobilized or they could apply forces to the bone of known magnitude and number. So the first important point was when they immobilized turkey wings, and these are living turkeys, for just 6 weeks, there was a 10% loss in bone mass. So the same thing that we've been seeing. But when they applied high intensity loading forces, only 4 times a day, 4 times, that was completely sufficient at preventing loss. And then it didn't matter if they did it 36 times a day or 360 times a day. They got the same improvements. So here's where we get the information that just a few loading cycles that are high intensity can maximize the benefit to bone. So if you're going out to walk, and that's your usual form of activity, maybe you should work up to jogging for just, 100 steps. That might be enough to increase the loading forces on bone to improve bone strength. Another important point here, Sue?
Well, I was just going to say, is jogging the only way to do that? Because we've been hearing about things like stair climbing.
Actually going uphill or downhill is a great way to increase the loading forces. Even doing some things like, walking a little bit unusually, so you're loading the skeleton a different way, not just always moving in one plane, but doing crossover steps. Walking backwards is going to engage different muscles and change the loading forces. Just variety of how you change the forces that the bone is accustomed to seeing. So you can get very creative on how you do this. The fourth important point is that this didn't continue to go up. So this brings about the point that once bone has adapted to the forces you're throwing at it, it has adapted. If you wanted to continue to get increases, they would have had to increase the amount of stress they were applying to that bone. Overload it. And the last important point is look at the magnitude of changes here. I told you in humans we can get increases in bone mass or density of 1 to 3%. These are 40% increases, which are huge. And when they looked back and looked at their model, I heard a talk from Dr. Rubin discuss this. You know that most bones, long bones, have a natural bow to them. So our muscles pull bones in a certain direction. And when they looked at their model, they found that they actually had the bone turned 90 degrees. So they were bending that bone sideways rather than along its natural bend, which meant it was a very unique stress to this bone, something it had never seen before. And when it adapted to that very unique stress, it was a large magnitude response. So, increases in bone density in humans are generally pretty small, 1 to 3%. And we know that those changes, those increases, are smaller than the increases that we typically get with the drugs that we use to treat osteoporosis. And we know that those drugs have anti-fracture efficacy. They're all good at preventing fractures. So, why should we bother trying to prescribe exercise to either prevent or treat osteoporosis when taking a pill is so much easier? Well, I think there's two reasons that I want to convince you of. Going back to the animal studies now, we can't do these studies in humans. You'll understand why in a moment. On the left side, there are going to be 3 slides like this. On the left side, these are things that we can measure in humans: bone mineral content and bone mineral density. What I'm going to reveal to you on the right side are things that humans don't like to volunteer for, because we actually find out how much force a bone can endure before it breaks. So we actually directly measure bone strength. So these are classes of drugs called bisphosphonates, that's Fosamax, Boniva, those sorts of things, that bring about pretty large increases in bone mineral content and density, and they also bring about increases in bone strength. But you'll notice, this is what I want you to focus on, that the improvements in bone mineral content and density are roughly proportional. So we get 14 to 15% increases here, we get 7 to 20% increases over here. So roughly proportional improvements in bone strength. Here's another class of drugs, PTH. This is called Forteo on the market, where again we get nice increases in bone mineral content and density and roughly proportional increases in bone strength. Now here